What's the best method for losing weight in 2025? Is it this new class of injectable medications like Ozempic, Wegovy, Mounjaro, or Zepbound? Or is it bariatric surgery, which seems to be getting safer, less invasive, and more widely covered by insurance than in previous years? In this video, I'm going to compare weight loss medications versus weight loss surgery across 5 different categories: effectiveness, lifestyle impact, risk, cost, and long-term results. Then I'll give you 5 questions that you should ask yourself if you're deciding between medication and surgery. And finally, I'll wrap up by telling you why I chose bariatric surgery over weight loss medications. I'm Joel, and you're watching Joel Gets Swole. Before we get started, if you find this video helpful in any way, it would mean a lot if you subscribed and share this video with a friend or on social media. Now let's start with the effectiveness of these newer weight loss medications. First of all, Ozempic and Wegovy are just brand names of the drug semaglutide. Similarly, Mounjaro and Zepbound are brand names for the drug tirzepatide. Semaglutide and tirzepatide were both originally developed to treat diabetes, but they've since been studied and approved to treat obesity. According to one study, people taking semaglutide for obesity lost on average 15% of their body weight, more than any previous weight loss medication at that time. Tirzepatide had even better weight loss results, with people losing around 20% of their body weight on average. This means that a person weighing 300 pounds might expect to lose around 45 pounds taking semaglutide and around 60 pounds on average when taking tirzepatide. These medications are the most effective obesity drugs we've ever had, and even more effective drugs may be coming in future years. Now let's look at the effectiveness of bariatric surgery. The 2 most popular bariatric surgeries are the vertical sleeve gastrectomy and the Roux-en-Y gastric bypass. On average, patients can expect to lose between 60 and 80% of their excess weight after 2 years. A quick note, excess weight is defined as the difference between a person's current weight and their ideal weight based on BMI. So if a person weighing 300 pounds needed to weigh 160 pounds to be in a healthy BMI range, they would be considered to have 140 pounds of excess weight. There are 2 more bariatric surgeries, and they're considered the most aggressive. They're called the SADIE-S and the duodenal switch. On average, patients lose between 80 and 100% of their excess weight after 2 years. These 2 surgeries are the most effective treatment for obesity that we have today. If you'd like to learn more about the SADIE-S surgery, that's the surgery that I had, and I made a video explaining why I chose it. I'll link that above. So to wrap up the effectiveness category, I'm going to rank weight loss medications as moderately effective, because although these drugs are the most effective we have to date, they still don't provide a level of weight loss comparable to bariatric surgery. And for that reason, I'm going to rate surgery as highly effective. Let's look at lifestyle impact. The lifestyle impacts for weight loss medications can be relatively low. In most cases, they will require a weekly injection. Patients will feel less hungry and feel full for longer. Although diet and exercise is recommended for best results, people often experience weight loss without massive changes to their diet while on these drugs. The lifestyle impacts for bariatric surgeries can be quite high. It can often take several months to be approved for surgery. Recovering from the surgery can take weeks or months. Surgery requires a complete change in diet following the operation, and often requires lifelong vitamins to prevent deficiencies or malnutrition. So for lifestyle impact, I'm going to rank medications as having low impact and surgery as having a high lifestyle impact. Now let's look at risk. There are some risks associated with weight loss medications. Side effects can include nausea, diarrhea, constipation, or sometimes in rare cases, things like pancreatitis. Also, these drugs are relatively new, so there's limited long-term data. Surgery carries higher initial risks compared to weight loss medications, but it's far safer than it's been in the past. Most procedures are performed either laparoscopically or robotically, which reduces risk and recovery time. Still, any surgery has risks, including infection, leaks, blood clots, and other complications. These surgeries are usually irreversible or only partially reversible. They also have a long recovery period and potential for malnutrition or vitamin deficiencies. Depending on the specific surgery, there can also be a risk for reflux or gastrointestinal symptoms. So for risk, I'm going to rate medications as having relatively low risk, and for surgery, I'm going to rank them as having moderate risk. Now let's consider cost. These new weight loss medications have exploded in popularity, but they're often not covered by insurance, and paying for them out of pocket can be more than $1,000 per month. Surgery can also have a large upfront cost depending on insurance. Some people opt to have surgery out of the country to find more affordable options. There will also be some ongoing expenses, including lifelong vitamins and blood work. So I'm going to rank both medications and surgery as having high cost, considering that if you need to pay out of pocket for either of these treatments in the US, they'll cost many thousands of dollars, with the surgery being a large upfront cost and the medications being a large ongoing expense. However, there's a big asterisk because this depends greatly on your insurance coverage and financial situation. Now let's look at long-term results. There's limited long-term data for these newer weight loss medications since they haven't been approved for weight loss for very long. What we do know is that weight loss occurs only while actively taking the drug. Weight regain is very likely after stopping the drug, although not all the lost weight may come back. There's more long-term data available for bariatric surgery since the procedures have been around for many years. Some weight regain is common after bariatric surgery, as the procedures can lose their effectiveness over time. But this varies depending on the surgery, with the SADI-S and the duodenal switch having lower weight regain than the gastric sleeve or the gastric bypass. Now, this may be controversial, but for long-term results, I'm going to give weight loss medications a low ranking, since the weight loss only occurs while taking the drug, and it may not be feasible for many people to remain on the medication for the rest of their lives, either financially, maybe they change insurances, or due to supply shortages. For bariatric surgeries, I'm going to rank them as either moderately or highly effective long-term, depending on the surgery. Although some weight regain can happen years after surgery, it's rare for individuals to regain all the weight that they lost, and this can also be addressed with revisional surgery. So those are my personal rankings, but what about you? Do you think I got it right or wrong? Let me know in the comments if you would rank them differently. Now, if you or someone you know is considering between these two options, here are 5 questions that can help guide that decision. Number 1, how much weight do you want to lose? Weight loss medications are recommended starting at a BMI of around 30, though that can be lower if you have other conditions. Bariatric surgery guidelines start at a BMI of 40, although again, that can be lower if you have a comorbidity. And I know BMI is a controversial topic, so maybe we'll cover that in a future video. In general, if you have a lot of weight to lose, you'd probably want to consider bariatric surgery over medications. Whereas if you have less weight to lose, you may want to consider trying the weight loss medications first. Number 2, what level of commitment are you able to give? Bariatric surgery requires a massive commitment and lifestyle change, especially right after surgery. If you're not able to make that commitment right now, that's okay. Weight loss medications may be a great first step towards getting you to your health goals. Question number 3, what level of risk are you willing to accept? Weight loss medications and surgery are both going to have risks associated with them, but they also come with great potential benefits. A thing to remember is that staying obese or morbidly obese for many years also has risk. Things like high blood pressure, type 2 diabetes, liver and kidney disease, heart attack, stroke, and even some cancers. There's also a risk of not living the life you want to live or being the person that you want to be. Number 4, what can you afford? This is very dependent on your individual situation, so it's worth looking at what your insurance covers and what you'll be able to cover out of pocket. Number 5, what does your doctor recommend? This might be a fairly obvious one, but talk to your doctor and see what they think. I'm not a doctor, and I'm not giving medical advice. I'm just offering my opinion as someone who's been trying to lose weight for many years, and I've had to consider these choices. So that brings me to why I ultimately decided to have bariatric surgery instead of pursuing weight loss medications. The biggest reason is I had a lot of weight to lose. My highest weight is over 430 pounds, so I'm looking to lose well over 200 pounds when all is said and done. It's not that losing that weight would be impossible with medication, but statistically, it's much more likely with bariatric surgery. Costs and insurance also played a big role. I don't have the world's best insurance. It's just a bronze plan off of the marketplace. So no surprise, it did not cover Wegovy or Zepbound, but it did cover bariatric surgery. So after I paid my deductible for the year, my surgery was fully covered. I was also interested in having a one-time surgery versus being on a medication for the rest of my life. I was worried about the availability of the meds, as I've seen some articles saying that there's supply shortages in the different medications. I also wanted to take aggressive action. I didn't mind taking a huge life-altering surgery as long as it gave me the best chance for long-term success. So that's my story, but what about you? Are you considering weight loss medications or bariatric surgery? What's been your experience? Let's start a discussion in the comments and see how we can support each other. If you found this video valuable in any way, again, it would be a huge help if you subscribed, share this video with your friends or on social media. Thank you for watching, and I'll see you in the next video.